Hello, so somebody wanted me to talk about how to find the ureter, and two caveats. Usually, most of the times you won't be able to see the ureter, and this is for especially looking at the mid ureter to rule out if there's any stones. That's one. And the second caveat is the patient has to be very slim. With those two things out of the way, here we have the right kidney. You can see there's a little bit of pelvic fullness, and you can start to begin to see the proximal ureter. When you see that, you could always go coronal on the body, and you'll be able to see the UPJ, the ureteropelvic junction, and the proximal ureter. And that's a good place to look for if there's any stones. Another thing you can do is put the patient on PA, so put them in prone position and scan them through the back. And there you go, you see the kidney, right? Lower pole here, and you'll see the pelvis again, and you'll start to see the ureter, the proximal ureter. And if there's a stone there, you'll be able to see it. Always, you could use color Doppler, and sometimes you'll find the twinkle before you find the stone. So that's just another technique you can use. So then in the mid-abdomen, you can use either the curved or the linear. I always use both. You can see the ureter right here. Now, again, patient has to be slender, like this patient is. And you have to use a lot of pressure, because if there's any bowel there, the ascending colon's there, you're not going to see it because of the gas in bowel. So another thing, if the walls of the ureter are co-opted, you're not really going to see it. So you'll see it if there's any mild prominence of the ureter, if there's any reflux, if they have a stone. Sometimes if there's a very, very full urinary bladder, you can have a little bit of fullness of the ureter. Sometimes when you put the patient in prone, it compresses the ureter at the pelvic, at the UPJ, and also causes a little fullness. So those are a couple things. You would see a stone here. Here you can see there's some bowel gas not allowing me to see that part. So here's the ureter. And you can put colored Doppler to make sure that it's not a vessel. And here's the mid ureter with the linear probe. Here you can see bowel with a little bit of fecal material inside the bowel, kind of causing a little bit of shadowing. So here's your ureter, and you can see the urothelial thickness. If there's UTIs, sometimes this will be much more prominent, and you have some urothelial thickening like this. See here, you can see the ureter, a little bit of urine within the lumen, and you can see the wall, the urothelial lining of the ureter is very thickened in a patient with a UTI. So as you go more distally into the area of maybe like the appendix, right inguinal fossa, you can also follow it if, in fact, you can see it. And you'll see it'll start to dip down. Here's the urinary bladder. It'll start to dip down very deep, and you will lose it. But if there's any stones there, you'll be able to see it. Once you get to this region, then you can just go and focus on the bladder and use your bladder as a window. As you can see, the ureter entering right here. So see here, you can barely notice it. You just know it's there because that's where the ureter is. You could also put color Doppler, and you'll see ureteral jets. If there's a stone there, you'll see it like this. So here's the distal ureter with a stone. And then with the color Doppler, you see the twinkling artifact. Here's another example of about a mid-ureter stone, and you can see the stone right here, very bumpy. And with the color Doppler, you can see some twinkling artifact. Here's a bladder with a stent. So you can see they have a double J stent. So this is the portion that's in the bladder. And here's in transverse again. So there you can see the ureter, and then the stent going into the bladder. And here's a stent going into the pelvis. Again, so here you got a little bit of hydronephrosis. You got the stent, and then you can see going into the UPJ, and then proximal ureter, and then going down. And that's another example of a mid-ureteral stone. So you got your ureter, stone, psoas muscle, and then twinkling artifact. And then here's an example of that same patient in PA. So here you got the kind of the lower pole to mid pole of the kidney. And you got the ureter coming down, and then here's the psoas muscle, and you got your stone right there. So if there's a lot of gas and you're trying to come in from the anterior portion, the PA view can help. And here's another example. You see there's hydronephrosis, kidneys a little echogenic from edema with some perinephric fluid. There you can see it again. And in the mid-ureter, you can see the urothelial is a little thickened, and then the stone with twinkling artifact. So I hope this helps. Just remember, if the patient's very large or if they have a lot of gas, you might have trouble, but it doesn't mean you can't try. And also, even in larger patients, you can put them in prone and try to see it. If the stone's big enough, you should be able to see it. Use the curved probes and use your linear probes. All right, take care.